Hello everyone, my name is Lucy Yang and I'm a PGY1 pharmacy resident at Atlanta VA Medical Center. Today I will be discussing my project that evaluated and assessed duration of antimicrobial therapy in patients discharged on antibiotics for common infections at Atlanta VA Medical Center. Neither I nor my co-investigators have anything to disclose. And just some background information, inpatient antimicrobial stewardship have been widely focused on, implemented, and proven successful in inpatient outcomes. And about 75% of all United States acute hospitals have an antibiotic stewardship program. And here at Atlanta VA, we have a very robust antibiotic stewardship program that monitors inpatient antibiotic use prospectively. We also have hospital widespread empiric treatment guidelines that are available electronically as well as electronic order menu sets. But despite widespread implementation of antibiotic stewardship programs, the majority of antibiotics are actually prescribed in the outpatient setting. According to the CDC, in 2018, there was actually 250 million total oral antibiotics that were actually prescribed to patients to be completed in the outpatient setting. And it's been found that antibiotics prescribed at discharge have actually been associated with excess duration of therapy, and some are even found to be even inappropriate. This increases the risk of patients acquiring multi-drug resistant organisms and unwanted adverse reactions such as Clostridium difficile infections. Therefore, preventing unnecessary antibiotic use at the time at discharge is essential to improving patient care. So we conducted a retrospective study to evaluate and review the duration of antibiotics being prescribed here at our facility. We looked at patients who were discharged for common infections such as urinary tract infections, pneumonia, and skin and soft tissue infections. This is a table that lists the recommended duration of therapy for these conditions. The primary outcome for our study was to determine the excess number of days of antibiotics prescribed at the time of hospital discharge for these common infections, and the secondary outcome was to determine the most common antibiotics prescribed and the median duration of days. The study was conducted solely here at Atlanta VA Medical Center. A retrospective chart review was conducted for the time period of January 1st of 2019 through February 29th of 2020. Our time period stopped at the end of February 2020 because of COVID-19. For our inclusion and exclusion criteria, in order to be included, patients had to have been hospitalized for at least 24 hours or longer, diagnosed with UTI, pneumonia, or skin and soft tissue infections, and prescribed antibiotics to be completed in the outpatient setting. Patients were excluded if they had complicated infections and were diagnosed with more than one bacterial infection at the same time. This is a list of complicated infections that patients were excluded for. For example, sepsis, bacteremia, diabetic foot infections, COPD exacerbations, and immunocompromised. For our data collection, we collected basic demographics such as age, gender, and ethnicity. We also collected information pertaining to the inclusion and exclusion criteria previously mentioned. For our results, we reviewed 282 patients. 169 patients were excluded for either being complicated, admitted for less than 24 hours, being in the wrong year, either being a duplicate, or either had no encounter documented, and this left us 113 patients that were included in our study. And for the baseline characteristics, the majority of patients in our study were older African American males with a median age of 69. And for our results, we found that 16 patients for UTI were given the incorrect duration of therapy. For pneumonia was 20 patients, and for SSTI was 21 patients. So when looking at the results, at least half of all patients in every single diagnosis were given an excess duration of antimicrobial therapy. We also looked at excess duration of days per condition. For UTI, the median duration was 3 days. For pneumonia, it was 2 days, and for SSTI was 3 days, and the total median duration was 3 days. These are the most common antibiotics prescribed at discharge. For UTI, it was cifodoxime, pneumonia was levofloxacin, and for SSTI was doxycycline and cephalexin. We also looked at stratification by treatment teams. The chart on the left, a total of 113 cases, 56 were given appropriate treatment durations, while 57 were not. When comparing overtreatment by teams, we found that overall, hospitalists overtreated patients twice as much as resident teams for all indications. In addition, we looked at which treatment team actually documented the duration of therapy and which team prescribed that documented duration. We found that almost half of all cases actually had no documentation of duration, and the majority that were actually treated by hospitalist teams. So overall, hospitalist teams documented and followed their recommendations less when compared to resident teams. In conclusion, antibiotics were commonly prescribed in excess upon hospital discharge. Patients were prescribed longer durations of therapy from hospitalist teams when compared to training teams. Additionally, about half of all teams did not follow their documented total durations. For limitations to our study, one was that we had a small sample size. Due to COVID-19, we actually had to stop our data collection after February of 2020. This was because it was difficult to decipher between pneumonia and COVID-19, and another limitation was that data collected was also based solely upon the documentation in the patient's charts. So if it wasn't documented, we actually had no data. In conclusion, patients at Atlanta VA Medical Center diagnosed with UTI, pneumonia, and SSTI were prescribed excess antimicrobial therapy at discharge, which indicates an area for improvement and further analysis to determine why prolonged antibiotics were actually prescribed for these patients. For my self-assessment question, true or false, antibiotics are commonly overprescribed at discharge? And the answer is true. Using unnecessary antibiotics may increase the risk of acquiring multi-drug resistant organisms and may lead to antibiotic-associated adverse reactions. And I want to thank my co-investigators for their guidance during my research. Thank you. And here are my references. And if you do have any questions, please feel free to reach out to me, and my email is listed here. And I thank you for joining me.